It's Conduit News Radio with Paul Harrell.
Ladies and gentlemen, thanks so much for being with us. This is hour number 2. You found the intersection of conservative ideas and reality, where we are building a liberty machine. We want you to help us build it. You can call or text 870-275-9799. Also broadcasting across multiple digital platforms, as well as stations across the state, but over at facebook.com/Conduit News or the YouTube channel. When you get to the YouTube channel, make sure you subscribe and click the little bell for notifications. We would very much appreciate it. Folks, I want to introduce you to somebody. You've heard me talk about him before. You've heard me mention his YouTube videos. We've played videos from his channel. It is a privilege to get to introduce Dr. Keith Smith. He's from the Surgery Center of Oklahoma. Dr. Smith, welcome to the program this morning.
Thanks so much for having me, Paul.
Yes, sir. I'm really glad that you could make it. I've seen your appearances. You've been on national television. You've done interviews and everything else, and I think it's because at the Surgery Center of Oklahoma, you guys have thought outside the box. You can actually give people real prices for what they want to get fixed, and that is, in this day and age, that is an anomaly. Tell us a little bit about that.
Yeah, and if we just listen to ourselves have a conversation like this, it really points out and highlights how really diseased and sick the system of delivery of medical services is in this country. No one should really be talking to me or paying attention to me at all, because all we've done is say, here is what we do and here is how much we charge for it. And that's what every other business and industry must do to survive a competitive economy. Medical service delivery in healthcare is different because the government has gotten involved, and they do what they always do. They muck it up and it just becomes a mess. So at the Surgery Center of Oklahoma, because we're a physician-owned and controlled facility, we've eliminated the most greedy profit seeker from the equation, and that is the big institutional so-called not-for-profit hospital. And we charge patients what we believe is a fair price, and they travel to us from all over the country and even outside of the country to receive their care.
That's amazing. And I love your diagram, too. When you go to your website, the Surgery Center of Oklahoma website, it is surgerycenterok.com. That's surgerycenterok.com. You have the mannequin or the human diagram, and you click on the part of the body you need to get fixed, and then you list the different types of surgeries for that part of the body, and you actually put the prices right there on your website. I saw one video, Dr. Keith Smith, where you were saying one of your patients essentially equated the amount of money the surgery was going to cost to the amount of premiums he pays. I thought that was interesting.
Yeah, this fellow was proudly uninsured, and he was paying $1,500 a month for his insurance coverage. And, of course, that didn't include his giant deductible and copay. And our hernia price is about $3,000. And he would have paid $18,000 if he had insurance coverage, and then he would have paid, his deductible, which was about $6,000, before he ever would receive a dime of worth of care. So when he came to our facility, he said, so I didn't spend $18,000 on this insurance policy. I spent $3,000 with you. And he said, why would I buy 6 hernias a year when I only have to buy 1? So I thought it was pretty insightful.
Yeah, that is really good. 6 hernias a year when I only have to buy 1. That's fantastic. You mentioned that you're getting out of you're basically you've exposed the not-for-profit hospitals. You're eliminating them as the middleman. Can you talk about that? Because here in Arkansas, we have a lot of not-for-profit hospitals. We've talked about in the past how they really falsify their data of uncompensated care, and they testify before committees, I believe with fake numbers to try to get legislators to, get more government taxpayer money subsidizing their business. But, there's a lot of profit in these not-for-profit hospitals, it seems.
Yes, people need to understand that not-for-profit really kind of a deceitful phrase, particularly applied to a medical institution. Not-for-profit just means don't pay tax. And the hospitals, many of them are making so much money in spite of their claims, poor-mouthing claims otherwise, that they need to generate these gigantic charges and bills in order to maintain their not-for-profit fiction. They also use the charges they generate where they, their write-offs, what they don't collect, to justify these uncompensated care claims. So I tell people to think about the aspirin for which a hospital would charge $100, and then they accept $5 as payment and claim they lost $95, when everyone listening to the show knows that you can buy an aspirin, you can buy a whole bottle of aspirin for a fraction of $5. So there's a lot of funny accounting here, but the hospital will say they lost $95, and then that is used to justify the kickback they received from Uncle Sam in the form of boosted Medicare payments later on. All of this is enabled, of course, by the federal government. And so, whenever I hear Uncle Sam riding in on his white horse to save us from this healthcare system that's a mess, they created this. And it's a system that is designed to line the pockets of the folks that are the kind of connected insiders and those who buy at the auction of all of our liberties in D.C.
Are hospital and big doctor groups, are they, or I guess there's a difference there, but are hospitals intimidated by people who are doctors who try to practice outside of the authority of these giant hospitals? I know you've talked about that before, how, sometimes they kind of get offers that they can't refuse in terms of, hey, you're going to let us buy you out and that sort of thing?
Well, yeah, it's not just the physicians, it's also rural hospitals. So, there might be some small town in Arkansas, like there is here in Oklahoma, where a big hospital, roars into town and throws a lot of money at the feet of the primary care doctors. It's an offer they can't refuse. And then they buy their practices with all of this loot that they've taken from others and, bankrupting individuals to come up with all the money they have. And then these bought physicians are told that they're going to need to refer to the mothership in the big city that bankrupts the small rural hospital, and then they succumb to an offer that they can't refuse. So all of this, once again, is enabled by the federal government. People need to keep that in mind. These not-for-profit hospitals are just cronies that have bought these abusive favors from legislators. And it's not just the federal government. Many times it's county and state government, where certificate of need laws, where a group of entrepreneurial physicians who would want to create a Surgery Center of Oklahoma-like model in Arkansas or many other states run right into state laws which prevent them from doing that. So, at every point in a commercial exchange in medical services, some power-wielding bureaucrat or legislators got their hand out, and you have to pay the toll in order to move on. And we're fortunate here in Oklahoma that many of the laws that contaminate other states we just don't have those here.
Yeah, I mean, obviously, the success of the Surgery Center of Oklahoma is, evident. The entire nation watches that. I mean, we're certainly watching that as your neighbors. Here in Arkansas, I want you to talk a little bit about insurance companies. In Arkansas, we decided to expand Medicaid under Obamacare, but we had Republicans that had recently campaigned against expanding Medicaid. And so they came up with a different plan. They said that it was different. It wasn't the same, but instead of using a fee-for-service model like under traditional Medicaid, we instead will pay what is now over $500 a month, almost $600 a month per person on this program, which has topped 300,000 people at times. Whether they go to the doctor or not, the state basically owns insurance policies. The state and the federal government are paying these insurance companies $2 billion a year is what this program costs for the expansion. and they claimed that this was somehow embracing the free market at the time. And, of course, true conservatives knew what it really was, which was an expansion of government and dependency and everything else. But talk about how these insurance companies, feel free to address that, but also how the insurance companies have a perverse incentive to seek out the larger bills, things like that.
Yes, but all insurance companies, even outside of Medicaid, are inclined to pursue the most gigantic charges they can find because they make a lot of money selling discounts. And what I mean by that is in the $100 aspirin example, the $95 the hospital does not save, an insurance company would claim was a discount. Well, the insurance company inevitably goes back to an employer group and says, hey, look, we saved you $95 on this aspirin, and so now, per the terms of our agreement, we're due the 28% commission on that savings that we achieved. Of course, the employer group has no idea, or maybe they do, that these discount and initial charge arrangements are already predetermined between the insurance company and the hospital. In fact, I've been told that insurance companies have asked hospitals, can you double that charge and do a brother a favor, because that maximizes this skimming and discount opportunity for them to make more money. The Republican version of Medicaid or the Republican version of Obamacare, I've told people, that's like giving gin instead of vodka to an alcoholic and expecting a different result. Government cannot do this. I mean, the free market, now, which is really the opposite of government, the free market is the best way to allocate scarce resources. The most important point, though, is the poor deserve so much better than what Medicaid provides. And these capitated models where we're going to pay X $100 per person per month or per year, that invites what we call soft rationing. And then the prices that providers are paid for care are set well below what the providers consider mutually beneficial. And so, price controls cause shortages. And that's the whole point. That's how Canada restricts care to their residents. That's how they try to balance their budgets, is they make it more difficult for care to be accessed, and they just make it hard on everybody.
I want to back up. We're talking with Dr. Keith Smith, this from the Surgery Center of Oklahoma. I want to back up what you said, that the relationship between insurance companies and hospitals. I mean, what you described should be illegal, in my opinion. I mean, that's a level of collusion. It's almost like it's like insider trading to do that to somebody else.
Well, once again, people should be angry. They should be enraged at these hospitals and these insurance companies that are bankrupting us as individuals and as a nation. But all of these favors are sold by Washington, D.C. All of this is enabled by Uncle Sam. I tell people, you know who the cronies are. They're out front, but Uncle Sam's driving their getaway car. That these insurance companies and hospitals work together. Sometimes you'll see some high-profile, news piece where the hospitals and the insurance companies are fighting, and they trying to negotiate. Sometimes I think those stories are just not real. Sometimes they are real because there's another player in the marketplace that's mixing things up. But by and large, the hospitals view these PPOs and carriers as ATM machines. And a lot of these deals are prearranged. A lot of these gigantic bankrupting charges are pre-agreed to. And then employer groups are charged basically a fee or a commission to the extent that these false charges are reduced and everybody's pockets are lined, but the people paying for this care are bankrupted. And the reason I came to know all this is I couldn't figure out why not one single insurance company wanted to buy from the Surgery Center of Oklahoma with our known quality and pricing. Not one insurance company wants anything to do with us. And the reason is when I say a carpal tunnel surgery is $2,750, there is no opportunity for a big insurance company to discount that and rake in some skim off the difference. My price is my price. So it's a very messed up system. I'm very optimistic, though, because there are a lot of people that are copying us all over the country. And the old myth that you can't put a price on certain types of healthcare, that's already been blown out of the water. And so I think this idea of telling people, here's what I do and here's how much I'll charge, I think that horse is out of the barn. I don't think it's coming back. And it's a very creepy time, frankly, for the cronies in the system.
Wow. Dr. Keith Smith, I really appreciate you coming on the program. Very enlightening. I'd love to do it again sometime, and I want to thank you for being a leader, and I want to thank you for thinking outside of the box and really exposing what is an injustice in our society, and that's this government intrusion in our health care, getting between surgeons like yourself and, potential patients out there. So I thank you so much for coming on the program.
My pleasure. Thanks for having me.
All righty. Dr. Keith Smith, everybody. Folks, we're going to take a break.